this is the Sculptra butt lift. And so what we're doing is we're injecting Sculptra, which is a bio-stimulatory filler, into the skin of the buttocks area. And that is going to help lift, and it's going to help tighten, and it's going to help make the skin smoother too, which is great. As I go along, I like to wipe off my little marks, and we're going to keep on going. So we're going to go back in through the same channel, and we're going to keep just moving it around, and we're going up high here to get the area where we want to get the butt lifted to. Your cute butt. This is a great treatment to do in combination with cool tone, because it will, the cool tone will help with the muscle while this helps with the skin. So I'm going to keep going. Here we go. Back into our spot. I'm going to go off to the side. Okay. So Sculptra is made out of Poly-L Lactic acid, which is something that's been in use in the medical field since the 60s, and it is a bio-stimulatory filler. So right this moment she's not going to look real full. Well, she's going to kind of look full because there's a lot of fluid involved, but in about 3 or 4 days she's going to be like, where did all of that fullness go? And then it's because all the saline and lidocaine all gets absorbed, and then the Sculptra gets pushed down by the fibroblasts, and then the Sculptra starts doing its magic, which is stimulating collagen. Keep it on going. You feeling okay? Mm-hmm. Awesome. And I love the size cannula because this really does a nice job getting the product where we want it. To mix Sculptra, we mix it like we do for the face, and then we add 6 cc's more of saline or sterile water. And that is, and you have to mix it all really well together. And that's why I'm mixing each vial and then injecting each vial, because you can't let it sit. I have a vortex agitator that really does the trick too for helping to make sure it's really emulsified. The less amount of dilution, the more likely you are to have granulomas, which is what we don't want to have. So that's, especially when you're doing body, you really need to mix it well. Okay, one more over on this side. So I used 4 vials per side, 8 vials total. And some people need more. And I'm going to do some down here just because it'll help with the rounding out of her cute butt, and it'll help with the skin down here. Go off a little tiny bit over here. We want it majority up higher because we want it up here, so it's going to lift up there. That's what our goal is. Okay, so this side is all done. Why would you want to do a butt lift with Sculptra versus doing a Brazilian butt lift? Well, because a Brazilian butt lift has a lot of risks. This is non-surgical. This we can do in the office. It only takes about an hour. I'm going to go way up here because there's a little deficit up there. And you have 0 downtime. So you can go out and do whatever it is you want to do today, and you don't have to have any drains in. You don't have to worry about waking up from the procedure. And actually, there is a certain type of Brazilian butt lift that's now essentially outlawed in Florida because there were so many deaths associated with it. There's no deaths associated with Sculptra in the butt. So the Brazilian butt lift, you can get a bigger butt. Sculptra, you're not going to get a bigger butt. You're going to get a more sculpted, natural, athletic butt, along with the skin improvements that go with it. The way Sculptra works is that Sculptra is a biostimulatory filler. So it's going to stimulate your fibroblasts to make more collagen. And when it does that, it tightens and lifts. So it can do that anywhere we put it. You could do it in your face, you could do it above your knees, you could do it in your arms, and of course, obviously where we're going right now is in the back side. I like doing 4 vials per cheek, so 8 vials. You could do as little as 2 vials per cheek, but 8 seems to be the magical number for results. And I would sometimes even recommend doing multiple sessions. You may need to do 8 vials twice. It just depends on the amount of lift that you want and the amount of results that you're getting. Everybody's different. Sculptra works, you just have to do enough of it. Post-care, after Sculptra, I like to recommend that people wear some tight leggings because I think it just makes your body feel nicer, like a little hug. It helps keep your bottom, like I say, for the boobs, high and tight, and keep the bottom high and tight too. So other post-care, I always tell my patients you want to massage the area for 5 minutes, 5 times a day for 5 days. So that's the same for the bottom as well as for if you're doing your face. So 5, 5, and 5 are the magic numbers. And then really there's no downtime. She's not even bruised here, which is great. So it'll be really great for her when she leaves here to be able to have a regular day. So we got one more to inject, one more spot to inject. And again, I'm mostly doing this area just to help with the skin texture here. And we were just talking to our patient off camera since she has done this before, and she said that she actually went to a concert that same night that she did this before, and then went on a long car trip the next day, which is kind of like the massage part. So you could be massaging with the bumps of the car. So there's, like I said, no risk, no downtime. Again, safer than BBL and much easier for a more natural, athletic look to your bottom. So super easy. So if you want to find out if the Sculptra butt lift is right for you, you can find us online at RejuvenationMD, medspa.com.